this sales force, as well as our own staff doing monitoring. And you can see that there's been quite a lot of monitoring going on, and that has to do with folks who have been exposed and are in quarantine and being monitored. So this is our hospitalization curve that we've been showing you for the last few months now. And you can see that we leveled out to, about one person in the hospital. Had a few days where we didn't have any, spiked back up a little bit with a handful, even a couple in ICU, back down to just one person in the hospital as of today. So basically in terms of status, we have 0.1% in the hospital, 30% at home, 67.6 recovered, and 2.3% deceased. So this is our cumulative curve. If you can remember, we were waiting for this to plateau out, which it did, but then we had that uptick in June. So we're waiting for this to now plateau out again. And then our daily incidence curve by onset looks like this. So those were our cases from March and April. You see the significant spike we saw in mid-June. The rolling average graph, I'll show you a little bit later, helps smooth out some of this bumpiness and helps you see that curve a little bit better. But the other thing we track is the number of percent of positive tests per day. So at any point in time, if cases are going up, but the percent of positive tests are not going up, then that's probably an indication of just more testing, which is revealing more cases. If the percent positivity in the counting is staying the same. Conversely, if percent positivity is going up, and so basically it's like you have to look at those two measures together to basically discern whether or not your increase in case numbers is just more testing, or whether you're doing more testing and you have increased transmission, which would be an increase in the percent of positives by day. So you can actually see that here when it happened, when we had this second spike later in June here, where we spiked up and now we're on our way back down. And you can see that we also had an increase in our percent positive tests, which is now flattened out. So these numbers coming down while this number is flat is probably an indication of some lower transmission going on in the community while we continue to have testing. So by zip code, 48911 is still our highest prevalent zip code, followed by 48823, which is East Lansing, 48910, which is also downtown Lansing, and then some other zip codes there. We bring in Holton Mason when we get down to a couple of these other levels. 48906 is Grand River heading out towards the airport. So when we look at that by case range, we still see 48911 as the highest range, followed by 48823, and then the others. But if we look at that by rate, we still have the highest rate in our 48911 zip code, and then East Lansing 48823 and Lansing 48910 are in this second rate range, and then you drop off here as well as out here towards the airport. So if we look at a heat map that shows you where those cases are, you can see some clusters. This is kind of a county-wide, high-level view. We can zoom in and look at the zip codes 48911 and 48823, which have a number of cases, in addition to some hot spots in other zip codes. But as I've been saying, you can clearly see the 48911 hot spots, and a little less slow in East Lansing. It's just a little bit more diverse or dispersed spread, which causes just a little bit more clouding over the entire area, and you don't see those hot spots necessarily in the same way. Our cases right now, 49% female, 51% male. By age range, we are 31% 20 to 29. That is a demographic shift that's happened in the last month. We did show our 20 to 29 through our 50 to 59 age groups, roughly all in about the same percent of cases. Now we have double the amount of cases in our 20 to 29 age group compared to any of our other age groups in the county. If we look at our cases by race, they are 25% African American, 54% Caucasian, and 11% Asian, 8% other, and 3% unknown. We can also look at that by rate instead of simply by percent, because again, we have to adjust to the population, knowing that we have not the same, prevalence of a population within our total population, so we have to adjust for that. And so you see our Caucasians at 316, roughly 3 times that many in our African American population, and about 2.5 or so times that in our Asian population as well. If you'll recall, if you do these numbers in 48911, you see that Asian rate go really high and the African American rate lower, and then the Caucasian rate lower still. But we're not seeing those numbers continue to be the outbreak that we had before. So we've not been showing those graphs. If we look by ethnicity, it's 82.9% of our cases are not Hispanic or Latino, 9.2% are Hispanic or Latino, 7.8% unknown. So that gives us a prevalence that looks like this in terms of not Hispanic or Latino at 389 and Hispanic or Latino at 507. So you do see a slight increased prevalence rate in the Hispanic or Latino population based on those numbers when we calculate a rate. I really am just going to run through these because we haven't had a death reported since June 10th, so you have already seen all these slides. So I'm actually going to stop here instead of showing all these death statistics slides because they are the same ones that you've been seeing for over a month now. So, questions?
We have Kyle Kaminsky. Go ahead.
Hi, Linda. I was hoping you could just run me through where we're at with the Harper situation. Are they open right now, and how many cases has that plateaued out at? I know it doesn't sound like you're tracking it anymore.
It is plateaued at 187 cases. That's what it's been for at least a week now. And we are past the rounds of incubation periods for any primary cases, and we're approaching that for secondary cases as well. So if another case gets added to it, it'll be because of probably something that got connected after the fact or a late test result coming in. We've seen some test results lingering, but I wouldn't expect a lot more numbers. I believe 43 or 44 of those were secondary transmission, 43, and the rest were primary cases. So we pretty much are about to close out that outbreak.
And are they open right now, do you know?
They are not. They are not.
What needs to happen before that can take place?
Right now, they have not even attempted to open. So before they open, they will submit a plan to us that tells us basically all of the steps and measures that they're going to take. We have created a restaurant inspection guide template that now incorporates all of the various things we want to check off relative to the executive orders. So our restaurant inspection staff actually have a checklist in addition to their typical checklist that they would use for restaurant inspections that incorporates all of the questions we need to ask relative to the executive orders in terms of ensuring that there's compliance with that. So we will be ensuring that they're compliant with all of the typical food handling, safety, cleaning measures, signage, menu signage, all of the things that we would do for a full-blown inspection, in addition to everything related to the executive orders, making sure all of that is in place before they open. They are, completely cooperating with all of that, and at this point in time, have not submitted a request to reopen and have us come out to take a look at that, nor submit all those plans to us. So we are prepared to do that and work with them when they are ready to submit that.
As a quick follow-up to that, are you aware of the online petition to shut down Harpers permanently? It's got more than 700 people that have signed on to it now.
I've heard about it, yeah.
Gotcha.
That's, I mean, honestly, it's like we do inspections there. If we have a reason to close that restaurant, we will close that restaurant. So by petition is not the way we close restaurants. So
That was my other follow-up to that, is if a petition really carries any sort of weight at all with your department. It sounds like this would just be treated as a complaint, like any other complaint. Maybe 700 people.
Honestly, it's not, because complaints are real time. So when I receive a complaint, it's something that's going on right now that I can go out and investigate and find is either happening or is not happening, and can ask for corrections or corrective actions to correct it. When people complain about things that happened months ago or a year ago or whatever, it's like, okay, we're going to go in and do our inspections. And to the extent that any of those things, and most of them are part of an inspection anyway, those things will all get looked at, but not as a response to all of that. That is, right now we're in, basic inspection mode, basic compliance with all the executive orders. Stories about things that happened, that we cannot come in, and they're not open right now for us to go in and investigate a complaint. So this is all historical and doesn't really have a lot that's actionable on our part right now, except to, of course, make sure that all of those things are incorporated into a restaurant inspection, which they would be.
Thank you.
Mm-hmm.
Does anyone have any questions for Linda? Oh, Dave Ackerley, go ahead.
Hey, Linda, I'd like to stay on Harpers for a moment because if I remember correctly, at the time that the outbreak hit, I think either you said or something came out of Ingham Health that they had done things from the establishment standpoint in the right manner. Do you stand by that still now?
No, they said that they had done things in the right manner. So what we noted was, and in some ways they had, but when the executive order says, and I've been on this page since the beginning, and this is exactly what I told them, when the executive order says that people are supposed to wear masks in restaurants and that they had the ability to deny entry or not allow people to be in there without masks on, and they didn't do that, that was right in the executive orders and could have been done all along. 6-foot distancing was in the executive orders all along. So placing your tables 6 feet apart and then not doing anything to control people to keep them at those tables and seated rather than congregating and close together was also not doing, everything that could have been done. So yes, while there were a number of things that they were doing and were paying attention to, there are also some things that lapsed, and they are aware of that. So.
Thanks.
Mm-hmm.
Go ahead, Chris.
Hi, Linda. A lot of schools right now are struggling with the health and safety concerns in regards to opening back up for this fall. Have you reviewed the Return to Learn plan released by the governor's task force, and do you have guidance at all in regards to what the health department is recommending for school districts?
So yes, I have seen the return plan. We did actually have health officers that were part of the task force, that put together that plan. So there was local public health voice as part of that. So my colleagues, Nikki Britton, as well as I believe Denise Fair and maybe Lisa Peacock up in the northern part of the state, were all part of that and kept us up to date as things moved along. The school districts are responsible for those plans, and we are not responsible for reviewing and giving a check off on everybody's plans, but we are part of the school, the ISD meetings, working with the schools, helping them with that. I have one of my deputy health officers on that right now because I got a little busy, and so just a little bit. And so she's been handling that, and we do a lot of basically consulting and answering questions and helping when they don't understand the guidance. And as you might imagine, it's not a cookie cutter solution. Every district has got to take a look at that plan and see what things they need to implement in their districts, and how they go about all of those things. So we're here to help them and give them advice, but they are their plans to write under the guidance of the return plan that has been issued by the governor's office, and helping them to make sure that they're doing all the right things, as well as being here to make sure that we don't have outbreaks in schools and that we quickly respond if we start to have cases in schools and contain them is something we do. But keep in mind, we do that we contain norovirus outbreaks in schools, we contain chickenpox outbreaks in schools, we contain pertussis outbreaks in schools. This is, these are things we've done all along. But schools are definitely having to take a good hard look at what they're doing and how to basically deal with what I think is probably a very difficult situation, which is, the virtual learning that is safer in terms of infectious disease, but then, how do you deal with some of the disparities and things like that are likely to happen when you go to virtual learning and expect parents to do a lot of heavy lifting regarding children, and these parents might have jobs, they might be school teachers themselves, and so there's a lot to be worked out.
Thank you.
Mm-hmm.
Go Go ahead, Rachel.
Hey, Linda. Going back to Harper's, I had, knowing about their past, I looked at a few of their past health records. I'm not sure if you know anything about or remember any specific thing, but is there some red flag that they had that led up to the point of the closure that you know of? And is it common for some of the things I saw marked on their sheets or inspections, some of the things they said, which was like not cleanliness? I saw a
Those
few
are all
years.
actually fairly common. I mean, if you pull up a restaurant inspection from any facility, you're going to see some of those things. When we get into areas where we literally have a problematic restaurant, what you're going to see is inspections happening like 4 times a year, as opposed to just twice a year. You're going to see a facility that's brought in for an office conference and an informal hearing over continued problematic violations. So, it is not unusual to see any number of, cleanliness things, cold holding, hot holding, improper labeling, things like that. I mean, restaurants do the best they can, but inevitably there are things that we find when we're out there. Oftentimes those things are corrected immediately on site. So.
Is it common in Ingham County, do you know, or East Lansing specifically in that area?
It's just common across the board. I mean, I was a health officer in Kalamazoo before I was a health officer here. So I've been looking at restaurant inspections and, talking to reporters about, oh my gosh, here's this violation. It's like, well, calm down. That happens a lot, almost, in a lot of places. So, rest assured, when we have a facility that's an ongoing complaint issue, that when we inspect, we find usually it's repeated violations. You come in and it's like one time we find this and the next time that, but it's like when you go in and constantly find the same thing over and over again, then you're on a kind of a progressive action plan to correct some fairly significant things if they're not being corrected. And so those are one of our most important things, is to not see continued violations. And then there always could be a violation or something that would happen that would escalate a situation immediately. And we do have the authority to close down a restaurant immediately. So had any of those things happened over the course of the last 4 or 5 years, then those actions would have been taken.
Okay, and then last question, what do you think needs to happen in order for Harper's to open and stay open?
Well, I've had conversations with them about it, and I'm like, this whole, chaos that can happen in Harper's with, students all over the place, and we've seen it. I mean, I'm not making Harper's people sound bad over this, but it's like people dancing on top of bars and crowding in all over the place, and just, it's like, that can't be. This is not a time or an environment that we can have that sort of activity going on, after the, into the nightclub hours of a bar and restaurant. So, that they are very well aware of the fact that, Harper's as it was is an old normal that cannot continue right now. Now, how long that goes, I don't know. But I think you're going to see, as they open, kind of a different Harper's environment. And if it's not, then they won't be open for very long. Because if what happened in June happens again, then we're not going to be open for very long.
Thank you.
Go ahead, Kyle.
All right, this might be, it will be a better question to ask once they submit their reopening plan. But on Harper's again, given what you know about their past practices and their response to everything that's been going on lately, are you personally comfortable with their ability to reopen safely at this juncture?
Well, first of all, what we know about the past is what we see in inspections when we're there. Had people had complaints like we're seeing surfacing now, we could have investigated those at the time. So what I know right now is those are stories that are out there. I'm not saying that they're not true. I'm just saying that I don't have any way to go back and look at a complaint over something that happened in November of 2019 that was, this was dirty or this happened or that happened, and go and say, oh yeah, that happened. I don't have any way to do that. I have to base it on the inspections we've done, and then I have to base what's moving forward based on a solid plan and a commitment on the behalf of owners to do things differently. Do the owners of Harper's basically talk and act in a way like right now as if this has been a very humbling experience for them and they fully intend to do things differently? Yes, they do. Do I believe that they're, gonna, perhaps not follow all of that? All I know is if they don't, then we will hear the complaints really fast and they'll be closed again. So, it is in their hands. Are they capable of it? Yeah, they are. But they do know that they're going to have to do some things differently.
Thanks. Looks like all of us are working on Harpers today.
Yeah.
Dave, go ahead.
Hey, another question about Harpers.
Surprise.
Well, okay, but I want to ask you this: 187 primary, and I think you said 43 secondary. Do you know?
187 total.
All right, excuse me. Thank you. 187 total, 43 of those secondary. Of those cases, both primary and secondary, and a lot of them, or a number of them, I think maybe half or so, were not in our county. They were people who went to other counties, right?
No,
A little
actually over half of them were Ingham County cases.
Okay.
So.
Of those and the others that are out county, do you know how many of them were considered serious cases of COVID-19 with serious health effects, hospitalization, intubation, anything like that?
There were no hospitalizations. There were no intubations. Largely mild illnesses, fortunately. And I believe, at one point in time, there were about 25 or 30% of them actually that were asymptomatic. So we didn't see any hospitalizations out of that outbreak.
Do you attribute that primarily to the age group? I mean, you say that currently now we've got the ones you're following, we've got like double in that 20-some category. Yeah. Is that the age group? Because around the country, in a lot of states, not all states, but in many states, and I follow what goes on out in Seattle because it's where I'm from, where things kind of kicked off. They're having a similar setup to what we have in Michigan, right? It looks very similar. Very few hospitalizations, numbers about the same in cases. Is that due to just the youth of those?
No, it's due to a few different things, I would say. And of course, you're asking me to, be scientific and actually, use my head to try to discern that as opposed to like actually knowing, because sometimes we just don't know stuff. It's like you just got to use your science brain and go, well, probably this. So one is, yeah, you do see infection rates with the younger age group is far lower generally. Now, of course, that's not panning out in our cases right now because that's my largest, age range. But in general, if you look at the whole population across the world, across the United States, fewer young people have gotten ill. Far fewer young people die. The death rate in those age groups is very, very low. So we look at a death rate across the entire population. If you actually dissected it out by age group, which they did early on, you saw a lot of that dissecting out by age group. I think you're down at like 0.003% in some of the lower age ranges. And then you get into the higher age ranges and it's considerably higher. So you do tend to see a less severe course of illness. The problem is that we can't ever guarantee that. You also see a 26-year-old have a stroke. So we've got to be aware of the fact that we cannot be letting our guard down and be complacent just because we think that young people are going to be less likely to be hospitalized and all that sort of stuff. The other thing too is, even though we've seen this significant spike up, we did really kind of, quote, flatten the curve. I mean, if you look at my hospital curve and the numbers going down, 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 what that means is that in the hospital or in a hospital setting, sometimes maybe even in an ER, we are far better able to take care of more serious illnesses and possibly not even have them at a level where they get admitted. So you see fewer hospitalizations, you see fewer illnesses, and basically just like public health has been learning more about this virus, and it's like, oh, we should be doing this and we should be doing this thing as we kind of learn more. The clinical environment is also learning more about the disease and how to better treat the disease than they did in March. So you now see some hospitalizations that may have lasted weeks back in March and April that are a matter of days. So the effectiveness of clinical care based on the learning curve of this disease has remarkably progressed to where we have hospital stays that are shorter, fewer people intubated, fewer deaths for now. And of course, death is a later metric anyway. So cases spiked up, then where do the deaths come from it? So there often is a lag in that metric, but we're not seeing the serious illnesses and the serious long-term hospitalizations to the extent that we were. Part of it has to do with flattening the curve for the capacity as well as clinical treatment, as well as those age groups.
That's good. I like it when you analyze. Thank you.
Do we have any other questions for Health Officer Vail?
Just to confirm the numbers again, 187 total, 43 secondary.
I am pretty sure it's 43 secondary. I'm gonna pull that up for you really quick. I thought I had it right here. Here it is. Yep, 43 secondary, 187 total.
Is there anything else you're still tracking?
We are still tracking the Riverfront Animal Hospital outbreak. We're up to 21 cases there. 14 of those are Ingham County residents, 5 are Clinton, 2 are Barry Eaton District Health Department, probably Eaton County residents. And that number is now also, that outbreak is about to be closed out as well. So 21 as a result of exposure at that veterinary clinic.
What needs to happen in order for something to be closed out?
Basically a situation where you have exposure that cannot get controlled real fast. So one, under the executive order, a restaurant is required to close immediately if an employee becomes symptomatic while at work. So you'll see a closure of a restaurant just like that over that because it's right in the executive order. Other than that, you might see a restaurant that might have a positive employee or 2 that didn't necessarily were at work that day. They might have been someplace else and then they got notified they were positive. A lot of times you'll see the restaurants out of abundance of caution go ahead and close and do the deep cleaning anyway. And sometimes we recommend that depending on what the time frame was from when the employee was last on site and when we knew that they were positive and whether there's any exposure or risk of contamination on site. So you might see some temporary closures there. After that, it becomes closures over, outbreaks that are out of control. The Riverfront Animal Hospital situation was out of control. The Harpers situation was out of control. And then you might see some other closures based on staffing. If too many of their employees get sick, they have staffing issues. And then we are enforcing the executive orders right now. So when we go out and do restaurant inspections and say, okay, here's our, here's the COVID list, here's what you can and can't be doing. And they're like, well, we're not going to do that. And it's like, well, that's in the executive order. You can't do self-serve. Well, we're going to do self-serve anyway. No, you can't do self-serve. But we're going to do self-serve anyway. Well, you're closed then. So there you go. We just close them.
I meant the closeout within tracking.
The outbreak investigation.
Sorry.
That's
Yeah,
okay.
so the closeout of an outbreak is basically 2 incubation periods since the last exposure window of a case. So if we had an exposure window that went to the 20th of June, we go 28 days beyond that in terms of 2 incubation periods to get out from the primary exposure.
Okay, thank you.